Upper eyelid surgery is now the second most common cosmetic procedure in the U.S., and with more than 500,000 procedures performed each year, that number seems to be growing. And now a minimally invasive option called ZipLyft is offering patients an alternative to just the traditional eyelid surgery with little to no bleeding, minimal downtime too. This thing sounds very interesting. Joining me now live is oculofacial plastic surgeon Dr. Mark Berkowitz. Dr. Berkowitz, thanks for joining us today.
Oh, thank you for having me.
So Dr. Berkowitz, you're a board certified and fellowship trained oculofacial surgeon. This is, we don't come across these kind of surgeons often. So, thank you for your expertise. Thank you for joining me. I do want to break down how, first of all, we've been seeing eyelid transformations happening all across Metro Detroit and beyond. And for it to be named the second most common, cosmetic procedure, pretty crazy. Talk to me first about what upper eyelid surgery is and how traditional works versus this new ZipLyft.
So I'm an oculoplastic surgeon. I've been doing this for the past 30 years. And the ZipLyft is amazing. Compared to the traditional method, most doctors use a blade to remove the excess skin that's there. And of course, with a blade, you're going to have bleeding and swelling and black and blueness. I actually put down the blade about 30 years ago. I use a laser, and the beautiful part about the laser is it stops bleeding, so my patients heal faster. But this new ZipLyft is fantastic in that it can help to remove the excess tissue just by gently compressing the skin. And in doing so, patients get back to their activities faster, less swelling, less black and blue discoloration, and they don't need stitches.
With that being said, how does traditional recovery compare versus the ZipLyft recovery?
So what we're finding is with the ZipLyft, patients are healing faster because of the fact that they have minimal to no bleeding. There are no stitches, and sometimes people are allergic to the stitches as well. The incision is perfectly aligned and symmetrical. And so instead of having downtime of 7 days to 2 weeks, it's more in that 3 to 5 day range for them now with the ZipLyft.
That sounds incredible. Now, I do want to warn viewers, this is a graphic video coming up soon, so viewer discretion is advised, but I just want to show how this tool works without showing the full scope of things. But if we could just play this real quick while we talk about this. So this tool, Dr. Berkowitz, almost reminds me of an eyelash curler. It literally just goes right on the eyelid and then kind of clamps the lid together, right?
That's correct. So it gently compresses the skin, and I first will mark out the incision lines and then gently place this onto the eyelid. And you can see here it's placed over both lids. Then the skin is skillfully removed, and then a fine line is there that I just place glue over the area afterwards. So no stitches, because some patients are nervous just about having the stitches removed more than the surgery itself.
Yeah, I can only imagine. Also, I do want to pull up some before and afters of some procedures you've done here. I've seen a significant difference from these pictures, from the before and afters. Talk to me about what patients are saying, how they're feeling about this, and is this something that we're going to see more often?
So eyelid surgery, when I first started 30 years ago, most people were having it done because of vision being blocked. Now what we're seeing is they're doing it more for cosmetic reasons. And so excess skin, we're seeing patients as young as in their 20s coming now because they're unhappy where their makeup is being placed, or people are asking them if they're tired and they want a very natural look. And what I'm able to do now is to sculpt that excess skin and fatty tissue, whether it be with the laser that I use or an instrument like the ZipLyft where we're using it just for the excess skin, and get them back to their regular activities quickly.
And let's not forget, you're not just transforming eyes and eyelids, you are transforming faces. Talk to me about some of the things Accent's cosmetic surgery offers and how people can just get to know what they need or what they want.
So education is one of the biggest parts of what I do. Even if somebody decides afterwards, or I help them to decide that a surgical procedure is not for them, I want to make sure they are in the correct procedure. We are not cookie cutters. Accent's Cosmetic Surgery has millions of dollars worth of procedures because we want to make sure that we put the client in the right procedure for them. And so we take a lot of time during the consultation to make sure that we are helping to obtain the results they're looking for. So we do everything from facelifts to non-surgical procedures. I have this new laser called Junera that I'm bringing in that's unbelievable. With a tiny little incision, no stitches are necessary. I'm able to sculpt the face and the body as well. And we also have brought in a lot of Korean cosmetic procedures as well in order to have no downtime procedures too.
Yeah, and for anyone who's looking for more information, the website is on your screen, accentscosmeticsurgery.com. Just taking a look at some of the before and afters, for someone like me who loves talking transformations, I gotta say, it is pretty, I'm gravitating toward body contouring and facial contouring, cool sculpting, all that stuff. Is there something that you see a rise in that people are really doing right now, especially here in Metro Detroit?
So I just had myself and a lot of my clients are having radio frequency to the skin to help tighten the skin and firm the skin without any downtime at all. So I have a procedure called Oligio that I've used on my skin, and it really helps to transform. And I need to get right back to work. And so I'm able to, have the procedure, and then if I need to operate on somebody else later that same day. And so no downtime procedures are very popular, especially from the Korean market. And what's happening is that now we're looking at having procedures almost as if you're getting your nails done or having your hair done. It's part of the regular routine, but it has to be done in a facility where they understand exactly what they're doing in regard to the anatomy.
Yeah, I mean, it makes sense, and especially to have an oculofacial plastic surgeon right here in Metro Detroit. Super excited to see more of all the amazing procedures, the tools, everything else that you're equipped with at your facility. Where are you located?
So we have two locations in Sterling Heights, Michigan, and in West Bloomfield, Michigan. And we've been here for 30 years.
Yeah, and hopefully 30, 40, 50 more years, because I'm sure I'm coming very soon. Dr. Berkowitz, thank you so much for joining us today. And we'll put your link on our website at fox2detroit.com. That way, anyone who just even wants a simple consultation, they can get all the information on there. So we appreciate your time.
I appreciate you. Thank you so much.